Good evening, everybody. This is Massachusetts Governor Charlie Baker. I'm sorry I can't be with you tonight, but I want to start by congratulating the VNA of Boston for 130 years of getting it done on behalf of the people of the Commonwealth of Mass. And I also want to congratulate you on your 11th gala. And I also want to say congratulations to Mike Minogue, the CEO of Abiomed, who has been a true leader, not just in the healthcare space, but in the philanthropic space as well, during his time as head of that wonderful organization here in the Commonwealth. And I also want to congratulate Diane Bergeron for the recognition you're receiving for years and years and years of doing what I would consider to be one of the toughest jobs in healthcare, which is helping people work through terminal illness. It is something that I think in some ways the VNAs in particular have been leaders on this issue, not just in a medical sense, but in a cultural and a community sense as well. And I think it's terrific that the VNA folks are recognizing your work and the work of everybody who plays in the hospice space, because it's such an important part of the healthcare system. And I also want to congratulate Mutual of America. Even though you're a New York-based organization, you do tons of great stuff in the community here in Massachusetts, and we really appreciate it. I think it's fair to say that everybody knows that healthcare, as the population ages and as the system gets more and more sophisticated, it has more and more capacity to serve folks in the community. And for years and years and years, decades, the VNAs and the VNA of Boston have always been one of the so-called tips of the spear with respect to our ability to reach out collectively and touch folks in the community and help them manage their health care and their situations in the setting they deem most appropriate, which most of the time happens to be their home. Obviously, as healthcare moves forward, the population is going to keep getting older, including me in that category, but don't tell my wife. And I think one of the great things about having such a strong and successful VNA network here in Massachusetts is the ability that you have to reach out to people, to meet them literally where they live, and to help them deal with all of the big issues that we're all going to be dealing with when it comes to an aging society and a healthcare system that's increasingly going to be delivering care and service and support in the community. I hope you all have a great night, and I believe, as I said, that you folks in the VNA space are going to be a big part of our work collaboratively here in the Commonwealth as we work to reach out and serve the needs and interests of our population here. Have a great night.